Hey everyone, I'm John Lind, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Jason Rose. He's CEO and board member at Clearsense, and Jonathan Cook, CTO at Clearsense. Welcome, guys.
Thank you.
John. Thanks for having us.
Yeah, excited for this discussion. Before we dive into the topic today, why don't you tell us a little bit about yourself and Clearsense?
Sure, thank you. Thank you again for inviting us here to talk today. So again, my name is Jason Rose. I'm the CEO of the organization. I've been here about 14 months now. 30 years in healthcare and healthcare tech. First 10 years were on the provider side, implementing Cerner and other applications for the provider side. Took a different track on managed care and value-based care for 20 years and came back to the health system side about a year ago. So really happy to be here. With respect to Clearsense, we are a data enablement platform company. And so what that means is that we help health systems revitalize their data that's stuck in their systems in a lot of cases, and help them pull that data out and use that data for different purposes. This is hundreds of different types of applications that we work with, and identifying different tangible ROI, whether it be application active archiving or healthcare data lake systems to drive clinical trials or AI validation, things of that nature. And so we work with typically large multi-billion-dollar regional and national organizations to help them use their data in different ways.
That's awesome. And how about yourself?
Sure. I'm John Cook, the CTO with Clearsense. Jason and I have known each other for probably about 15 years. So Jason gave me a call last year, and I came to join Jason. Really, really interesting market with archiving, working with Jason. My background, 25 years technology, 22 years in healthcare tech, and super excited to be working with Jason at Clearsense.
Yeah, it's awesome. I heard someone say that data is gold. Clearsense, I guess, is the refiner to make the gold useful.
Yeah, oil.
Oil, yeah, that works
as
well. I like that. Well, you made two big announcements here at Vive. We're in Nashville. You're moving your headquarters here to Nashville, which is pretty awesome. And you also have a significant brand repositioning as well. Why don't you catch us up on why Clearsense made these two moves?
Well, so first of all, Nashville is known as the Silicon Valley of healthcare. So there are nearly 1,000 different hospital and healthcare companies in greater Nashville. $98 billion a year of revenue is pumped out of the Nashville region as well. 330,000 jobs are in healthcare in Nashville. So whether it be obviously HCA or any of the other large for-profits, and the hundreds and hundreds of other companies, us being one of them, being a part of the Nashville Healthcare Council, is a dominant part of the industry. On top of that, if you think about from a tech perspective, Amazon moved their Eastern Service Excellence headquarters here about 2-3 years ago. Obviously, Oracle just announced their corporate headquarter location to here as well. There's countless other tech companies like ourselves that are moving here. So it is absolutely the Silicon Valley of healthcare. With respect to the other announcement for us is we rebranded our organization, and I consider it a strategic rebrand. So we didn't change the name of the company, but we changed, I'd say, everything else about how we wanted to position ourselves within the industry.
Okay.
So we consider ourselves a data enablement platform. And again, that goes back into revitalizing your data for other use cases. And so we have two major offerings that we'll focus on. One area is active archiving. So taking, most health systems, there was a Gartner report last year that said that health systems have 20 to 30% of their applications are bloated and are wasteful.
Okay.
And there's also cyber risk on that. And so we at enterprise scale can drive maximum value and accelerate the value to take the cost out of the system. The other product, we call that ReviveCS. Our other product offering is centered around our healthcare data lakehouse, where we're not just taking the archive data, but also the active clinical EHR data and identifying whether it be 20 years ago, I always like to say cumulative, complete, and accurate data, so that it's all the data and it's also near real-time data as well. So that enablement allows you to do lots of things in terms of bring your own technologies.
Yeah, I think we should dive into that a bit more, the Clearsense data enablement platform. JC, maybe you could give us a kind of an overview of it, and and I love it. You highlighted some of the benefits, compliance, cost, et cetera, but give us an overview of the platform.
Yeah, so I think the easiest way to give you an overview is to get a little bit of a history of the company. So the company has almost a decade in archiving. And in archiving, our engineering teams and our technology has learned to take not only EHR clinical data, but data from financial systems, data from actually other archive systems. Like think of document archiving systems in these health networks. We are extracting data from all of that. We've been doing that for almost a decade. Oddly enough, that is actually harder than pulling data out of a modern EHR. So we've built techniques for archiving that lended themselves perfectly to modern data extraction for EHRs. So what we do is we take the data health lake house approach. We take the raw data, we bring it in. That I jokingly call that the data swamp. Some people call it a lake, right? But we turn that swamp into a lake, we'll say, right? But then we take that and we curate that data based on the customer's needs. So the customers decide, do you want warm data? Do you want hot data? Do you need cold data? And based on their need, we can adjust that in our lakehouse. And then we snap on top of that, we have two products, as Jason said, our ReviveCS and our RevealCS products that will snap down on that. But more importantly to our clients is that this lakehouse allows them to bring their own tools. So we don't force them to use our applications. They can bring their own tools and snap it in. And then I call it bring your own vendor. If they want to bring their own application or their own vendor, they can snap their vendor down on our data as well. So in that case, we have what they would call archive data, but we revitalized it. In many cases, the data in our lakehouse is actually more accessible than it was in the old system. So not only have they saved money on shutting down the old system, the data now is more available than it was. So that lays the foundation for our data enablement platform. And then we sell the two products on top based on the customer's needs.
That's a fascinating point, that you're actually freeing up the data, because many of those older legacy systems weren't interoperable. They were built before interoperability was an idea or even available. That's really interesting. Let's talk more about the ReviveCS active archiving solution. Maybe you could start, Jason, and tell us what's unique about the solution and where do you see it kind of pioneering new ground? We've obviously had archiving for a while, but what's unique about it and where are you going with it?
Yeah, there's again another Gartner report last year that talked about the top 3 issues with health systems today is identifying areas for cost reduction, it's revenue creation, and it's the cyber risk. And so our active archiving product hits all 3 of those at massive scale. So typically, most archiving companies will go to a health system and they'll look at a small set of applications, a couple dozen or so applications, because there's been some rollout of some new application, typically Epic, and they'll carve out those applications, and over a couple years they'll remove some of the costs. We take a very different fundamental approach. We look at archiving as a business issue, because it's not a tactical project. It's actually it's an enterprise business problem. It stretches across clinical and HIM, legal, procurement, the end users themselves, et cetera, cyber. And so if you think about the context of 20 to 30% of those applications are bloated. They have never had a strategic review, or maybe you have done some app rat program that sits on the shelf, but it's actually never been fully implemented. And why is that? It's because you haven't put in a business governance and strategic view of how you prioritize those applications, how you extract the data, how you feed a SaaS system like ourselves in terms of the archiving, and then measure all the ROI. And so, for example, we have one health system that covers 26 states, about 100 hospitals. We have cut 10% of their applications. It's about 750 applications over the last 4 years that we have reduced out of their portfolio. We have another 10 to 20% probably over to the time to come. And that does not even include the big Cerner application that's being removed. So it's probably going to be double that as our target in terms of $100 million of cost takeout. So it's a strategic review of, as the health systems are doing a ton of mergers, acquisitions, as they're rolling out Epic and Workday and other applications, and looking at their cyber risk, how do you do that at massive scale? And also make sure that the business is agreeing with the prioritization and creating that supply chain of applications.
I love that. So you kind of made the business case. I have a feeling you can make the tech case for what makes your product unique. You know, what do you see as kind of unique to your product and where you're pioneering new ground?
I actually don't like the term archiving.
Okay.
We're revitalizing the data, right? So archiving, when we think of, is we're taking the data, we're putting it in a box, we're putting it in a warehouse, and it's going, where the Raiders of the Lost Ark went, somewhere in a warehouse, right?
The same place that
somewhere in
Enterprise data warehouse.
right? Yeah, right. What we're doing is we're extracting that data and then we're curating that data. So that data is in a proprietary format quite often. We're curating that data into a format that is understandable by the client. And we work with the client. Our data enablement platform enables configuration to curate that how the client wants to use it. And then our reporting mechanism can be configured for their use case as well. So we work with them to figure out what is your use case, and then we configure the platform to support their use case. So, and many times the data coming out of these systems, they have better accessibility than they ever have. And better yet, we actually consolidate it. So if they bring us data from multiple systems with the same patient, we can map it together. So from a single pane of glass, they can see the same patient across multiple systems. And that's not only EHRs, that's EHRs, financial systems as well, scheduling systems, or down to imaging.
Oh, wow. I love that you're able to give that, kind of longitudinal view that, everyone wishes they had.
Right, in their normal workflow.
Yeah, that's awesome.
That's an important point. We support not only coming into our tools to access the data, we have APIs, and most of our customers actually use the APIs, embed them directly in their EHR.
Okay.
So if you're in Epic, for example, and you're looking at the current medical chart, you can hit a tab and it will bring up everything we know about the patient across all of the systems that we've archived for the client.
Without the user even knowing that.
Yeah. And we all know if it's not in the EHR, they probably aren't going to go dig for it unless it's something crazy.
Of course, physicians are not going to log into another system.
No, it doesn't happen. Yeah. I thought it was interesting. Klaus said that Clearsense delivered the largest, most complex decommission projects with the highest implementation support quality of any vendor. Quite a compliment from Klaus.
We were surprised to hear that. We were surprised.
Yeah. Tell me more. What does that represent? When you hear that and you hear that from your customers. Klaus is, talking to your customers. Maybe you could start
Well, Jason can handle this better than I. So.
No, yeah. It goes back to enterprise scale. So, if you don't look at this as an IT project, and you look at this as a business problem, you have a cost takeout. You have a cyber issue. You've got management of too many applications in your bloated application portfolio. And how do you actually create that supply chain that I was talking about earlier? And the only way to really do that is to get a strategy in place along with the executive leadership of the health systems at the very beginning, and ensuring that you're creating that prioritization model and ongoing return on investment. Frankly, it really needs to start with a mandate from the top that everyone's going to play on board, particularly with health systems that we often work with are multi-regional as well, because it hasn't had an enterprise look versus each region or each hospital having their own fiefdom, so to speak. So really looking at it more strategically, but then having the ability to create that platform where you can have literally dozens of applications being decommissioned at once on any given month, which is how we typically operate, and that goes on for years. And as we often are working within the M&A, the merger and acquisition department of the office of the CIO, and the reason why is because there's so much M&A. And now that there are a lot of market dynamics. There's going to be even that much more M&A as well. So it's not going to stop at all. So really, both having a tech platform that can handle the massive amount of concurrent applications that need to be decommissioned, but also having the business side of creating that momentum and that velocity to accelerate the value. Really, everything about our organization with our strategic rebound is about client value. Okay. And so we focus on client value. If it's not something that the client will get value out of, then it's probably not something we should be endeavoring on. So we are all about how do we have tangible value. I've worked, in 30 years in healthcare. I've been up against every actuary you can imagine about bending the trend and things of that nature. But if you look at active archiving, that is the most pure, tangible ROI. A CFO can look on a spreadsheet and say, I agree with the pre-post. I was paying software licenses before this was decommissioned. These personnel were either changed or contractors, whatever the case may be, or repositioned to another area, and I have less of a footprint or infrastructure cost. It's a very pure ROI, and it helps fund other innovative projects as well.
Yeah, I mean, from my aspect, 20 some years as a technologist in healthcare, and I've worked in pop health, I've worked in accreditation, a number of other fields. I have never seen a clearer return on investment than active archiving. You can, as a CIO, you can clearly, or a CFO, you can clearly see what you were paying for software, there's licensing, that hardware, and then that's not even taken into consideration. What's my security risk on this outdated OS, or those zombie systems that are laying around because everyone's scared to shut them down? You take those out, and you can measure that against, what we're charging the client, and it's a clear return on investment for them.
Now, I saw a stat last year, 67% of the health systems in the United States had a successful ransomware attack on them last year. Not scary. Not a attack, that's 100%. Right. Successful attack, amazing. 67%. So it's the zombie apps, it's the unsupported portfolio of applications, and I'd say that's a softer ROI, but on top of the cost takeout. But it's a real problem that really requires a disruptive way to look at archiving. Yeah,
and then you add in the accessibility of the data that we already talked about as well. I mean, all three of those make for a beautiful ROI. I love that. We talked a lot about ReviveCS. Let's talk about your other solution, RevealCS. Maybe you could start and tell us a little bit about it.
Well, I'll start and I'll pass it on to JC. So if you think about a layer cake, so at the often our entry point will be the active archiving because it is that pure ROI, and frankly, it's extremely complex to be able to integrate data from hundreds of different disparate applications. But then how do you revitalize that data to other use cases? And to JC?
Yeah, again, it was a natural evolution. So we're doing archiving, we're revitalizing that data, making it available. Well, the natural evolution is, why don't we take your live EHR? We can pull in your live EHR as well, and we can mix it so that you can look at your live EHR data at whatever frequency you want. We call it timely accurate data. Mm-hmm. And timely is based on what your needs are, or your needs hours, days, or months of refreshes. We can accommodate all of that. And so with that, we're pulling in the live EHR, we're mixing that with the archiving, and you can slice and dice it however you want as a client. And then on top of that, we're giving the ability to do cohort stratification. And a number of our clients are using that for pulling clinical trials. We have use cases where they're pulling out data sets for training LLMs, which is really interesting. Watching our clients actually use our tools to pull out data and then train AI.
Customized to their data, that's
exactly. Yeah, they'll pull out different cohorts and train different AI models with it and then compare it. It's pretty interesting.
Now you coined a term at Vive here. Yeah. We always talk about bring your own technology, and I hadn't heard it until I think earlier today, is bring your own vendor.
Yeah, BYOV, bring your own vendor. Yeah. So our idea is we're not trying to sell you the apps on top. We're creating the foundation, the data enablement platform to support you how you need to work with your data, and be it bringing your own tools or bring your own vendors. So in the case I was talking about the AI, our clients were bringing in AI vendors and using our tools.
There are 9,500 AI companies out there, and so we're not trying to compete with being 9501. We want to be the data enablement middleware sitting below the data warehouse and above the apps, and bring your own technology, bring your own vendor, bring your own proprietary tools, so that you have good, clean, timely, comprehensive data.
Yeah, and we hear over and over again that if you don't have the right underlying data, the AI can't do what it needs to.
Garbage in, garbage out.
Yeah, absolutely.
Yeah. The other thing that we learned with the AI with our clients is AI is as good as the data you feed in it. Everyone has heard that. That's not new news, right? But AI is also as good as the question you ask it. Like, just think about 10 years ago, we would have never been talking about prompt engineering.
Yeah.
Like, am I asking the right question? Am I giving the right context? And it was interesting watching our clients. We had one client that was doing this prior to us. It took them 9 months to get the data right, and they realized they were asking the wrong question. They had to go back and retune the engine, and they started working with us, and they were doing what took them 9 months in 15 minutes. So we jokingly said, we help you fail fast. So they were asking the wrong questions, tweaking their questions, and then using us to pull the data.
I love it. That's great. So where can people go to learn more about Clearsense?
Well, obviously you can go to our website at www.clearsense.com. We are very often going to trade shows. We're all over LinkedIn. We do a lot of thought leadership. So look forward to hearing feedback from the industry.
Awesome. Well, I appreciate you both coming and stopping by to share your insights and perspectives. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks, guys.
Thanks
Thank
a lot.
you.
Appreciate it.